Good evening and welcome to the Board of Health meeting Tuesday, October 19th, 2021. We have no hearings or appointments scheduled, but we do have, I think, some awesome news. We are about to, depending on the vote of the board, appoint the health agent and sign an employment agreement. So, we met Jean Marie last week. And obviously the board has decided to move forward. You and I had a couple of discussions and talked about a few things. Are you ready to move forward?
I am.
Excellent. All right. Does the board have any last minute questions or comments, concerns? Okay. So at this time, I'd entertain a motion to appoint Jean Marie Joyce Kent as the health agent for the town of East Bridgewater, contingent upon the paperwork, contract needs to be signed. We need to have, Corey needs to come back, but after all those operational elements are done, I would entertain a motion to appoint Jean Marie Joyce Kent.
Marie Kent.
Kent Joyce, I apologize, as East Bridgewater's health agent.
Effective November 1st, right? Is it so?
Effective November 1st, correct.
Motion.
Okay, that's motion, Lisa.
Seconded.
Second, Matt. Any discussions? Hearing none. All in favor?
Aye.
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 The motion passes.
So, I gave Jean Marie the employment letter that was emailed to us, so she just has to put it, terms accepted with her name and date, so she's got that in front of her.
Okay.
There's no actual contract.
If I apologize if I said contract, I meant employment agreement.
So there's nowhere for the board to sign or anything, she just has to accept the terms.
Right.
Yeah.
But I have.
You have a copy of it in front of you there.
Yes,
Yep.
I mean, there is one that I have signed, and do you prefer single copy or double-faced?
She's actually signing
Okay.
the copies in front of her now. I gave her two, to do two originals, so we could give her one.
So while we're doing the paperwork there, we have approval of a work permit from 19 Allen Street and 0 River Road. Now, so 0 River Road, we've been talking,
There's an add-on to it.
and there's 20 hidden acres.
So the 0 means basically that the planning board, they've not assigned them an address yet.
Correct, right. But there was some, I think there's some pieces that they need to finish up.
That was 0 Plymouth Street,
Right, 0 Plymouth Street.
not.
River Street.
River Road, yep.
River Road.
Let me just look at that. Requires street address, yeah, so that's all, just requires a street address prior to issuing a COC. So before the certificate of compliance is issued, we'll need a street address for it.
20 hidden acres.
They should all be good to go.
Okay.
Oh, I thought you were talking about the one we had from the planning, from River Plymouth Street. That was the huge problem. That's why I got confused.
You know, I think you have mine. I truly do. I don't know what's happening here, but, okay. And that was- Allen. Zero River Road. Okay, so I'll entertain a motion to accept the disposal works permits as presented for 19 Allen Street, 0 River Road, and 20 Hidden Acres. Okay, this motion, Lisa.
Second.
Second, Matt. Any discussions? Hearing none. All in favor? Aye. Okay, it passed unanimously. Okay, so why don't we switch back to our new health agent? Papers are signed?
Yep.
Well, let me be the first to officially welcome you. Really excited and looking forward to having you start on 11/1, so.
So isn't she?
She came up to the office
And-
yesterday and got a tour. She got a tour of the office yesterday,
Spent
yeah.
some time with her yesterday.
Excellent.
Yeah, yeah.
Okay, great. So,
We've got her a phone ready to go for 11/1, a cell phone.
Excellent.
They're working on her email,
okay,
and she mentioned some, some field books that would be helpful, so we'll look for those for her. But yeah, so should be all set to go on 11/1. And actually, while she's here, we can kind of go into that discussion item number 1. It kind of talks about our inspections.
yep,
So I just want to kind of make, so have you guys make, do an official, so we currently, have an MOU for Title V. I did let Mr. Bucher know this morning that we were appointing a health agent today.
mhm,
And I did already talk to Jean Marie when she popped in yesterday about how she would like to schedule perk tests. So we've already come up with a program for scheduling after 11/1 for her.
Great.
So Mr. Bucher, he has an MOU anyway, so there's really nothing formal to do with him. We just gave him the courtesy, and he said, obviously, if you ever need him in the future, feel free to give him a call. But Mr. Casper has been doing our food. So I think probably just as far as the way our budget's done, we should, are you sinking?
no, my chair is sinking, it's,
I was like, is he making a
you
basic?
never show up late for a meeting again, that's for sure.
I think just because
It's
part of our
perfect.
budget includes
Thanks,
food
Matt.
service, we, a two-part thing, I did let him know, he's almost to the end of his second round of inspections, so he does them in the spring and the fall. And she and I discussed this yesterday, he would like to finish out, because he's got some follow-ups to do, so he'd finish out for the month of November.
Fair enough.
And that would get him done with his full round. So I mentioned that to Jean Marie, and that might give her the month of November to get acclimated with she could certainly go out and introduce herself to some of our restaurants, but as far as the actual inspections, but because that's part of our budget, I think we probably need to make a formal vote, because we made a vote to sub them out at some point, I don't know how many years ago, we should probably make a formal vote to bring them back in effective January 1.
You know how many he's got left?
He does them in bulk, so what do we got on the bill today?
That's what I was, what are we looking at for
2, 3,
amount
4,
here?
5, 6, 7. It's probably about the same, probably another $800 and some odd dollars. So we're gonna be okay budget-wise this year, just because we had an empty seat for a little while. So just have him finish out his fall round, and then, effective December 1st, it would all come in-house.
Okay,
That-
why don't we get through, when's our next, I left the phone in the car.
Meeting?
Our next scheduled is, so we're gonna go back on cadence.
The first?
Yeah, so the next schedule is November, but I think he just needs something, he needs to kind of know for sure for his own budgeting purposes. That's why I told him I was gonna bring it before you tonight.
All right. Okay, so we're looking for a vote for Bob Casper or for both Bob and
So,
Bob.
yeah, nope, we don't need to vote on Bob Bucher, because he
Right,
was just
he
an
is an
MOU,
MOU.
yeah. So Robert Casper would just be to have him finish out
Okay.
his round of inspections, and then effective December 1st, we would bring them in-house to our health agent, because that's
Okay.
how we kind of came up with the budget.
To Matt's point, do you know how many are outstanding?
I do not know exactly how many are outstanding, but he does them, if you look at this month's bill, that's about the amount, he does them in quarters, so it's probably about another $800 is my guess.
Okay. I'm just,
So he does them so, he didn't do any in June, so the last ones he did was in May, so then they go in November. He didn't do any in June, so November is his last for the fall rounds.
all right, so. So we're gonna make this starting 11/1, excluding inspections and process that he needs to finish up, is that correct?
No, so we're making a motion to let Mr. Casper complete the fall food service permits with relinquish over to our healthcare agent as of 12/1.
Okay. All right, I'll entertain a motion to move the food service inspections back in-house starting 12/1 to be performed by the Department Health Agent and allowing Robert Casper to finish any open food inspections through November.
Motion.
Second.
Okay, so this is a motion, Matt. Second, Lisa. Any objections? Any conversation? Hearing none? All in favor?
Aye.
Aye. Okay. If we could just get a number from Bob as to how many we've got open.
Yep, yep,
Just
so, yeah, I just got his bill this afternoon for this one, I haven't had a chance to go compare who's left, so.
So Sue, any office updates?
Well, first, we still have to
What's that?
pay Mr.
Let's
Casper.
Pay Mr. Casper first.
All right. So we have a bill for Robert Casper for $825. Entertain a motion to pay the bill as presented.
Motion.
Motion Lisa,
Seconded.
second Matt. Any discussions? Hearing none. All in favor?
Aye.
That passes.
Okay, so, as far as office updates, thankfully, court got canceled this morning and postponed till November 23rd, which stinks, because that's Thanksgiving
I was
week.
gonna say that's Thanksgiving.
Yeah. We've had, the school contacted me yesterday with, questions about whether we'll offer any kind of, clinic, COVID vaccination clinic for boosters, now that all three are gonna, expected to be approved within the next week or so. And the 5 to 12-year-olds when they are approved. So, obviously, Jean Marie's just gonna be getting in the door November 1st. So that's something we'll have to sit down and talk about, and we'll have to talk to Tim, and we'll have to see if there's any CARES Act money left, because when we did all these clinics last year, we had funding for them. So we'll have to see what the funding is like.
Well, I think the availability of vaccines and boosters is
Yes,
pretty
yeah.
forthcoming, so
Yep.
it's.
Yep, so, I mean, obviously, if we can do something for the community, and Jean Marie wants to do something for the community, we'll, we have the refrigerator, we can order it, but it's just a matter of, obviously, we need Heather, but then we need several paramedics,
Celebrities,
Yeah. So, and I know, the chief did tell me, over the summer that sometimes it was hard to find people to sign up for the details, so, people, have other things going on, so we'll have to, once she's on board on November 1st, maybe we'll, have Heather come in and have Tim come in, who's the fire chief, and they
I
can
know
come to
there
you
were,
and talk about it.
There were several nurses on the town nurses.
That
page
volunteered,
that
yep.
Would volunteer.
Yep, and we can
um,
go that route too. So, I mean, so,
needed.
lucky Jean Marie, I'm gonna be handing this all over to her in November, so, I already told Karen Clifford that you guys were gonna be appointing a new health agent, and that, I told her, when she's here, we'll have you come over, she can come over there and you guys can all meet each other and, just, come up with get a relationship going with everybody that she needs to have a relationship with. So that was that call. What else is going on? I just saw you like 4 days ago, so, off the top of my head.
Any mosquito issues?
No, then the mosquitoes have been quiet. COVID, I posted a COVID update today. I think we had like 53 cases since October 1, so they are down a bit, which is good news. The school has definitely not had as many cases, which is good news. The test and stay has been successful. You know, for those of you on social media, there was a big shindig on social media about about the YMCA today. For anybody listening at home, that was not accurate information, and if there's ever any question about something, if it's being handled properly or not, just reach out to our office and not social media.
And-
Right?
Well, I'm not gonna ask what it was.
No, I mean, it was just about, you know, that the person that posted it, I know I actually didn't, it was taken down before I saw it, but they, you know, they didn't think the Y handled it properly, and in fact, they did do everything they were supposed to do, so. So that was that. So I think, the only thing, you know, left I had was the meeting schedule, try to get back to that first and third Monday if we
Yep.
can. You know, especially, since she's gonna now be here Monday nights too, so it'd be good if we could do that. That'd bring us to November 1st and 15th, I believe. Your first day, meeting on your first day. So was able to send Rob a message during the meeting, and he said he has 14 or 15 left to wrap up.
Okay, great, thank you. And is 12/1?
He said he's gonna do, they're all due in November, so he would get them done in November.
So basically, any new ones that came in, I do in November.
So if we get
So I
new,
can follow
yeah.
up with them in December and not.
Yeah, so if we get a new establishment, you would do it?
Or a complaint or
Or a
whatever.
complaint, yeah, all yours. This is just his follow-ups.
Right.
Or just if you want to chat.
Anything else?
I think, yeah, I don't have any more notes right now. Like I said, I think we just saw each other Wednesday, so, that's it. Unless you guys have something?
I don't, guys.
I do not.
Mr. Spagone.
I just came in for support. My name is Peter Spagone. I'm on the Board of Selectmen. Congratulations.
Hey, Peter, thank you.
Yeah, so I'm liaison from the board to Board of Health. So
Board of
I try to
Health.
pop in when I can to see what's happening. I spent many years on the Board of Health prior to going to the Selectmen's office.
That's why your name's familiar, yeah.
If you don't know already, you're one of about 4 new hirees that the town has.
We've been
has brought
bumping
in.
into each other.
Yeah. You're gonna have like a tour for
Yeah.
everybody so they know where they're supposed to be going. Yeah, we've got a new town administrator, our accountant's fairly new, and at the same date, yeah, the
Conservation,
conservation
yeah.
will be the same time as you are. So we're excited
Yeah.
about bringing in some fresh new ideas and some people that I think will help us move forward in a lot of the direction we're going. So, but I just wanted to, from the Selectmen's Board, just welcome you and
Great, I
look
appreciate
forward to,
that.
yeah,
Thank
helping
you.
in any way we can as well.
Thank you.
Yep.
All right, excellent.
Yeah.
Thank you. Okay, so that concludes pretty much the agenda items. Does anybody have anything else they'd like to discuss? All right, so I'll entertain a motion to close the meeting.
Motion?
Okay, that's a motion, Matt.
Second?
Second, Lisa. Any discussions? Hearing none. All in favor, say aye.
Aye.
Aye. So thank you, everybody. That concludes our meeting Tuesday, October 19th through Board of Health. Thank you very much and have a great week.